Hi, I'm Jessica Gorin with New Hampshire Hunger Solutions. I'm the Deputy Director, and today we're talking about a New Hampshire Hunger Action Plan and how our organization used state partnerships to improve nutrition equity to operationalize equity in food access and nutrition security. Before we get started, I just want to give my colleague Tiffany a chance to introduce herself.
Hello, I'm Tiffany Brewster, also from New Hampshire Hunger Solutions. I'm their Community Engagement Director.
So our system of food and nutrition supports is like a power grid that moves healthy food to households. In New Hampshire, the grid is well developed in some areas and patchy and non-existent in others. And this is often the framework we use to describe our system of food and nutrition supports in New Hampshire, because it just seems to make the most sense for people to understand that this is a systems level issue when we're looking at hunger in our state. So what are those systems of food and nutrition supports? They are our SNAP programs, school meals, summer meals, the WIC, the Women, Infants, and Children's Program, and CACFP, our Child and Adult Care Food Programs. These are our federal nutrition programs that we know are evidence-based in alleviating hunger in our communities. In New Hampshire, however, we do pretty poorly in those programs. We are 47th in school breakfast participation, 39th in SNAP participation, 32nd in the child and adult care feeding programs, 25th in the summer meals program, and our WIC program serves only 44% of those who are eligible. So we have lots of work to plug people into that food systems grid. Meanwhile, we see that food insecurity is on the rise in New Hampshire. As of the most recent Census Pulse data, which was in September of 2022, over 68,000 New Hampshire residents said that they didn't have enough food, and 404,083 New Hampshire households said that they had difficulty paying for usual household expenses. Prior to COVID-19, you can see that we had high rates of child food insecurity, with our most rural and hard to reach regions of New Hampshire experiencing the highest rates of food insecurity. You can see in what we call our North Country, we had about 17.8% child food insecurity. So in order to improve food and nutrition access in New Hampshire and to foster the well-being of all New Hampshire residents, we need to make sure that more communities are plugged into this grid so that everyone eligible for food and nutrition supports receives it. So I'll turn this over to you, Tiffany.
Great. And so in order to accomplish this, New Hampshire Hunger Solutions work focuses in 4 primary focus areas. So the first being increasing school meal participation, second being increasing participation in other federal nutrition programs, for example, SNAP and WIC, and we do this through legislative advocacy and policy changes, as well as public awareness and data collection. A big issue in New Hampshire is the stigma associated with signing up for these federal nutrition programs. So changing that narrative is a big part of what we look to do in New Hampshire. And then also our fourth focus is on coalition building, supporting both emerging and already existing food access coalitions, but also seeking out communities that don't have any coalitions that are focused in food insecurity, nutrition insecurity, and helping to build those in those communities. So in New Hampshire, as Jessica mentioned, we're 39th in the nation for SNAP participation. So an estimated 17,000 children were eligible but not enrolled in 2019, and that looks like a lot of economic opportunity missed out in New Hampshire. There was an assessment done in New Hampshire where there was millions of dollars left on the table in federal funds that could have been funneled into New Hampshire throughout the entire COVID-19 pandemic. Another area that we're doing really poorly in New Hampshire is 60% of eligible older adults are not enrolled in SNAP. So it's a really concerning number for our older adult population. And as we all know, SNAP helps residents, it stimulates the economy as well. So we were able to gather data from the state as well as and impose that onto other data that we're able to get from public sources, such as the Census Pulse data, and we're able to determine the percentage of eligible that are enrolled in SNAP for New Hampshire. And so there isn't a single county in New Hampshire that has greater than 58% of eligible people enrolled in SNAP. And what that looks like for some regions is actually really abysmal, where as low as 37% of our eligible SNAP population are actually enrolled. Even further, school meals in New Hampshire, we only serve about 45.7 students for every 100 that are eligible for free and reduced school lunches. We're only serving 45.7 of those for school breakfast. So we're missing out on a large chunk of students who are already experiencing food insecurity that could also glean from the benefits of school breakfast. And we miss out also on substantial federal funding when that happens as well. And as we know, low participation is super costly for more than one reason. We have more likely to graduate high school when students are eating breakfast at school. High school graduates earn more money. They have higher test scores when they are eating breakfast. There's fewer school nurse visits related to hunger. And then we also know that it's a lifelong impact where we see reduced rates of obesity and chronic disease, both in children as adults. And so the fourth focus area of ours is coalition building in the state. And so we help to coordinate and co-facilitate the New Hampshire Food Access Coalition, which is focused on bringing folks together to both engage and connect, and ensuring that folks are collaborating over different activities that are going on in the state. Also educating people about hunger and its causes, and making sure that we're all rowing in the same direction, singing the same song about hunger in our state. Like I mentioned, collaborating to address the systemic and root causes of hunger, as well as building power among leaders and communities to advocate for that equitable access to nutritious, sustainable, and local food. So really looking to get into the communities and giving a voice to those that otherwise aren't usually heard from. And we go even further into more than statewide. We have several statewide coalitions. This is a smattering of all the different coalitions that exist or developing in New Hampshire. We have split up the state by using the public health network regions. And so that's how we're looking at the state. And generally speaking, most people in the state know what you're talking about when you talk about the Lakes region. So it's generally how folks in our state will split up the state as well. And so we have been able to go into each of these communities and identify existing operations going on, existing leaders in the communities, and helping to bring those people together to then also solve issues that are important for local communities, but then bring those up to the statewide coalition. And so I'll hand it over to Jessica.
Thanks, Tiffany. So these relationships around the state that we've been creating to address food and nutrition access in our state have been super important. Through a conversation with one of our colleagues at the New England Dairy Council, they connected us to the New Hampshire Division of Public Health Services in the chronic disease section. And through that relationship and that meeting, we learned about the work that the New Hampshire Division of Public Health Services chronic disease section were doing. So they focused a lot on their diabetes prevention programs, New Hampshire heart disease program, the comprehensive cancer program. And as we know, like all of these programs really are focused on food as medicine. Healthy diets really do help and access to affordable, healthy, nutritious foods can have a huge impact on chronic disease. And so it just made sense to have this partnership. The other thing is that they work with public schools, and our work is to help to improve school breakfast participation. So we had, and they have a lot of their WIC programming is in this division. So there were just so many different relationships where we could work together and build capacity versus working in our own silos. So the other thing that they were working on is creating the New Hampshire State Health Assessment and State Health Improvement Plan. And because of this and some of the work that we were doing around the state, and because of their work around chronic disease and creating those priorities, it really made sense to partner again and start aligning our goals around the state health improvement plan and figuring out how can we improve nutrition access to address chronic disease and other health outcomes that were showing up in their state health assessment. So they had this grant that came across their desk from the National Association of Chronic Disease Directors to create a state action plan to improve nutrition equity. And we were able to apply for the grant pretty quickly. We found out about this in mid-December and we were awarded at the end of the month. So it was a 2-week turnaround on this grant. And the part of this grant was to create a state action plan with partnerships around the state and how we were going to address nutrition equity. One of the priorities was to expand the implementation of social determinants of health screening with our healthcare partners, and help to make sure that there was a referral process in place if healthcare organizations are identifying social determinants of health issues for their patients, that they have a place to refer them to. And then also working with our community partners to make sure there is equitable access to federal nutrition programs like SNAP, WIC, and school meals. And here are some quotes. And Dr. Trinidad Tellez is joining us today on this call. She's in our audience. And her quote is, "Collaboration requires trust, and trust requires relationship." This is something that she has said throughout this process. And also from Dr. Camara Jones, equity is not a process. Equity is a process, not just an outcome. And through this beginning process spine, we really learned that we needed to center our work in equity, not just use an equity lens. So what is the process that we used? Through working with Dr. Tellez, we were introduced to the culturally effective orgs framework. And we also ourselves work on systems approaches when looking to improve nutrition equity. So we broke this down into 6 meetings where we provided education to all of our statewide and community partners, including those local coalitions that Tiffany was telling you about. And we talked about these different topics. We looked at the systems approach, the introduction to the CE orgs framework, community engagement, data collection and analysis, bringing it all together, like how do you create action out of all of these things that you're learning, and then presenting what our partners decided to create as their activity. So what are they committing to improve nutrition equity?
Okay.
Tiffany.
Thanks so much. So we're going to walk you through just briefly in a general taste of what this education session looked like, but also walk you through what came out of them. So what are the outcomes and some of our actual state action plan SMART goals that our partners actually committed to out of these activities and these educational sessions that we put together. So the very first meeting that we had was about using a systems approach to improve nutrition equity, and then operationalizing equity in food security and nutrition. We laid that whole foundation and that groundwork to be able to talk about that with the folks that participated. And so this is one of the first activities that we did, was just to find out who was coming to our meeting. And if you notice, there's a lot of pins all over the map of New Hampshire. And so we were able to engage people from every corner of the state, as well as up here you see all of these pins were people that generally do work statewide. So we were able to engage folks on a really large scale across our state. Again, another leveling and providing the same context for everybody activity that we did was identifying our values that we're coming to this work with. And so this was a result of that activity, where you can see respect, empathy, compassion, cooperation, and health are really at the center of how people were coming to this meeting and the values that they were bringing. And so this is the systems approach for improving nutrition equity that we used. The framework that we used was the spectrum of prevention. And so just very briefly, many folks are kind of working at the bottom of this spectrum where it's strengthening individual knowledge and skills. But as we move up this ladder, it encompasses a little bit more and a little bit more up to that systems level approach. And so we really wanted to be able to build the state action plan so that it was reaching each one of these system level approaches at multiple levels, hopefully within one partner, but generally that our whole entire state action plan addressed each one of these levels as well. And I will pass it off to Jessica to talk about the introduction to the culturally effective organizations framework.
When looking at how do we center our work in equity, we had reached out to Dr. Tellez to talk about the, to teach us about the culturally effective organizations framework and how we could integrate this to bring in nutrition equity. And so, Trini, I see that you're here. Did you want to say anything to this before we get started?
No, well, I can just pipe in because I'm not completely sure. I can't remember what this is at this moment. just you know, I mean, I'll add in as helpful.
Okay, great, thank you. So, Tiffany, if you can go to the next slide, that'd be great.
Absolutely, and I realize I have to fix something. I'm going to stop sharing for just a moment, and I think. Okay, sorry about that. Let me reshare my screen. There you go.
All right, thank you. So first, we just wanted to make sure that when we brought everybody together to talk about centering our work in equity, that we had everybody was working from the same language. And so we used and has discussion about, you know, what is the difference between inequality, equality, equity, and justice. And these images just help to represent those conversations and just to make sure that we were all working on equity. And so what is health equity? Health equity means that everyone has a fair and just opportunity to be just as healthy as possible. And so in order to get there, we have to remove the obstacles to health, such as poverty, discrimination, and deep power imbalances. And there are consequences, including lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So in our work, we understand that in order to achieve nutrition equity and health equity, we have to work on all the social determinants of health and make sure that everybody has equitable access to all of those services. So how do we do that? We use different frameworks, right? And we use our evidence-based tools that are out there in order to reduce health inequities as well as nutrition inequities. And so we use the public health framework. And through using this, we look at social inequities and what are the institutional inequities that are happening as far as, and what are the living conditions and risk behaviors and all of these things that are linked together. And what is the policy that helps us to change and improve those outcomes for people? And I think that it's important because not everybody that was coming to our work was coming from a place of public health. And so giving them this framework was really important. Public health is everywhere, right? We know that. And we know that public health touches almost any topic that we can think of. So making sure that we were providing the framework so that everybody was starting from the same place with the same level of information was really important. And we wanted to make sure that we were talking to people about systems and organizational level change. We know that there is, there's individual staff cultural competence, and that's what each individual person could bring coming to the table. But we also wanted to make sure that when we're speaking to people in these groups, that we are talking about what can their organization do, and what can their organization and they themselves do to influence the system for change. That's okay, Tiffany, you go ahead and go to the next one. So just as we go through this, we're going to highlight some of the activities that came out of these processes for each one of these sections. So in the systems change section, Foundations for Healthy Communities, which leads a population health work group with many of the healthcare organizations in our state, came up with the fact that by December, they will increase hunger screening and referrals at the participating hospitals in the peer group. By the end of this, we did identify at least 8 hospitals. So it's not quite December yet, and 8 hospitals have been identified, and they are working to improve their social determinants of health screening, which means when a patient comes in, they're screened to see if they need assistance around food access, fuel assistance, housing, career development, education access, and they are then referred to the proper resources in the community and connected through to them. We've also been working with these partners on training their community health workers and social workers on the SNAP eligibility and application process, and making sure that if somebody is identified for food insecurity, that they can be connected to those programs. Unite Us is the closed loop referral system our state is using within our community organizations to refer people to not just food services, but those other social determinants of health programs we talked about. We have a food access map in New Hampshire that was put together by UNH Cooperative Extension. You can see them over there in our partners section. They had identified 250 different food access sites across the state. The New Hampshire Food Bank has over 400 agencies. And so by December 31st, Unite has committed to adding into their referral system 250 sites across the state into their network, so that when people utilize Unite Us, they have those resources to refer people to when they are identifying as food or nutrition insecure. And the Northeast Organic Farming Association has also created an activity with many partners to start their outreaching to partners to strategize a plan to advocate for farm to school legislation. So this is really addressing that policy level when we're talking about the spectrum of prevention that influencing policy and level area, which has the most impact. This is this represents that policy area.
Okay, so to frame the next conversation and to frame all of our conversations, we try to return our audience back to the power grid metaphor that we talked about early on in this presentation. And so thinking about our system of food and nutrition supports like a power grid, we wanted to pose this questions of who makes up the power grid and who do we aim to serve? And in order to look at this, we also used the framework for culturally effective organizations. And earlier we were talking about bringing your individual cultural competency to the table, but then also this idea of organizational cultural competency, and to differentiate those and the idea that we're zooming out, looking at it as more of a systems level approach. We use this framework of culturally effective organizations, and we refer to organizations as culturally effective rather than cultural competence for an organization. So it's going to include all of these different aspects. And as we mentioned earlier, again, that this is also, we broke this up into pieces and walked through each one of these in different sessions and different education for our participants so that they could have the tools to look at their own organizations and their own systems that are put into place in order to achieve a culturally effective organization and systems in place. So the very first two that we dove into were language and communication access, as well as staff cultural competence. And so we have here language and communication access. We wanted to give folks the underpinning and all of the necessary definitions and needs to be able to address these things in their own organization at different levels. So we know that Interpretation is one thing, and I think that's what a lot of folks think about when they think about language and communications access, as well as translation of materials, but also thinking about other aspects like assistive technology for being able to see and hear, and then also having the language, not just the English or Spanish or different languages of the world, but also the ability to understand, the literacy, that's the word I'm looking for, the literacy to be able to understand health and materials of sorts. And then also thinking about individual staff cultural competence. There's multiple levels that our partners needed to understand to be able to see how that they can support their staff's cultural competence development. And so that can look like a lot of different things in both developing policies that integrate preferences into service delivery, as well as not only just continuous learning opportunities, but also supporting that at the organizational level and individualizing delivery of services, making sure that cultural needs are met and that cultural traditions are respected. And so our partners decided to tackle, we had a lot of folks that looked at their organization and went, wow, there's so much work that we need to do here. And so we did see a lot of activities come out of just these two ideas out of the culturally effective organizations framework. So the first one, the Greater Monadnock Public Health Network, we saw earlier the Public Health Network map. And so this was one of those public health networks. And we really strive to ask our partners, what other partners are they working with to ensure that all of the work that's going on is really integrated and interwoven into each other so that we can have that systems level change. So they had committed to, by December of 2022, that they'll ensure that all outreach materials and educational materials are translated and available in the most needed languages. And you can see all the list of partners here, and they have even more. Some of these are really categorical, faith-based and community partners. So that makes a huge impact for that entire region, where a lot of folks were looking around going, there's not a lot of diversity, it's New Hampshire, and really recognizing the need for that in that area. And then we had our Women, Infants, and Children WIC program for New Hampshire had decided that they would add an annual cultural competence training requirement for the state WIC agency contract. So they contract out to implement WIC in New Hampshire. And so for those contracts, they can set parameters. And so being able to set that parameter that cultural competence training would be required, this is something that funders can do as well. Anybody providing money can decide how that money really needs to be looked at and used. And then we have, of course, the New Hampshire Food Bank, big in New Hampshire, and they touch a lot of people and have a lot of partners. And so they had multiple tiers that they were looking at, one of them being that their contracts with Recite Me to provide support for those with disabilities and those who speak other languages. They wanted to get Cooking Matters back in schools for youth, particularly for those with low income, and expand opportunities to offer the program in languages that meet the needs of the community. And that has been historically only offered seldomly in different languages. So that was a really exciting thing, especially in our Manchester community, which is sort of our big city in New Hampshire, which there aren't many. So, and then also provide Hunger's Vital Signs RAT cards to providers. And then we have our community engagement piece. And so this was, again, a piece, just one part of the culturally effective organizations framework that we use to ask folks to look at their organization and evaluate how culturally effective they are. And bringing it back to that grid metaphor, this asks, are all households connected to the grid, and do we know how? And so in order to ground them in this, we wanted to establish a common definition of what community engagement is, and really differentiating community engagement from community outreach. And in order to help them do that, we have this community engagement continuum that we introduced to the group, where you can see the illustrations on this really help to just visually see what we're really thinking about when we're thinking about each level of community engagement. engagement here. And so the first one is really going out to the community saying, here's what's happening. And then the second one, consult, is here are some options. What do you think? Involving is here's a problem. What ideas do you have? And then collaboration being let's work together to solve this problem. And co-leading being you're connected to this issue and are leading efforts. And that's really important that we're co-creating together solutions and really putting people in the community in leadership positions and giving them the tools that they need to accomplish that. So we really encouraged folks in the activity, our partners in the activities that we did, to take a look at where they were, where they thought that they might fall on the continuum. And it is a continuum, so it's not just squarely in one section or the other. It can sort of evolve a little bit and be in the middle of two. So really asking our partners to look at where are they on the continuum and how they might be able to move a little bit further up on the continuum. And just a caveat to say too that all of these different places, there's a space for every single piece of this continuum. So for example, you might look at Inform and go, oh, I don't want to be at the bottom of the continuum, but sometimes you just have the information and it's not a moment that you're able to engage due to time and resources and all these things. And it is a matter of just informing your audience. So anywhere on the continuum might be appropriate for different activities, but we always want to look and see how we can go a little bit further.
Tiffany, before we go further, I just wanted to add in back up, if you can go back to the community engagement continuum. I think that one of the things that was really I loved about this spine grant that we had with our nutrition, creating nutrition equity, was working with community consultants. And the fact that we were part of this funding was to hire a community consultant from each region in that network, the public health network, to represent their region in this process. And so they participated in individual meetings that we brought together with Dr. Tejas and our community consultants and some leadership from New Hampshire Hunger Solutions to really talk about what issues were happening in communities, and also providing this similar background information prior to our community consultants attending a statewide spine meeting, so that they had all the same information going into a meeting that our community partners had. And then also they had this opportunity to network and interact with some of the community organizations that are at the statewide level that they might not have had that opportunity to interact with before, and also to provide advice to them. And I think that, we'll talk about this a little bit more, but it was really great to hear from our community consultants, like the great experience that they had to have that opportunity. And some of them even had like projects come out of that where they're leading efforts in their communities now to start pantries or change the hours of pantries to make them more accessible in their community.
Thank you, Jessica.
Yeah.
Great points. So some examples of this that partners came up with as our activities. The Community Kitchen is a great organization out in the Monadnock region that works with a lot of different partners, is very active in the community and bringing services to people, but also connecting the dots for folks as well. And so they, by December 2022, wanted to develop a program plan for training that engages people with lived experience around nutrition access, advocacy, and co-creation of a plan to address nutrition security in the region. And so this was exactly what we were hoping to see come out of the activities and the learning opportunities and the conversations that we were having, is this really deep ingrained community engagement and bringing alongside and bringing leaders from the community into the work that we're doing, rather than telling the community what they need. The Littleton Co-op by August 2022 had wanted to partner with the North Country Health Consortium to start a food council and set up training opportunities with a co-op board and staff around operationalizing equity. And this has come to fruition, and they have created a North Country Food Council, and it's had its kickoff meeting. They had a full day, and they had, I believe, correct me if I'm wrong, Jessica, over 60 participants show up for that, which is amazing, and had a lot of really engaged speakers. and a lot of action and activity and visioning and mission planning and all of these things that came out of that really rich meeting, and will continue on into the future. And then New London Hospital / Dartmouth had planned to host a food access event in September 2022, which again also came to fruition through the planning and partnerships that occurred out of the spine meetings. And they brought together food providers. Again, they had a full day for folks to connect across the region and be able to look at how to vision and mission, and looking at issues that were affecting people in their community. They brought in community members as well as people that are providing services, and had some training and amazing conversation. So Jessica and I were both able to attend that one, and that was a really invigorating day to attend. So I'll hand it off to Jessica.
Thanks, Tiffany. So the other thing is making sure that we're collecting accurate data that's representative of our community, and analyzing that data. And so this is a section of the operationalizing equity and food security and nutrition access that we talked about with the CE orgs framework. If you want to go to the next. So again, we're asking people, are all households connected to the grid, and do we know the quality and reliability of the power that they're getting? So how are we asking community members these questions? How are we collecting our data? How are we understanding what's actually happening, and if we are addressing the right issues? So data matters for health equity. Health equity means that everyone has fair and just opportunity to be as healthy as possible. And the following should be added when the definition is used to guide measurement. Without measurement, there's no accountability. So if we're not measuring our outcomes, we don't know if what we're implementing or what is happening in the community is actually working. So for the purposes of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. And if we're not asking questions about ability, ethnicity, gender, then we don't know if we're actually reaching the people that we are intending to serve, and if what we are doing is actually working, and if we're asking the right people the right questions. I think that those things were all really important when we're talking about data collection and analysis. And so we had talked to the group about disaggregating data. So making sure that we are asking the questions, and that when we're asking the question, we're disaggregating the data to identify the disparities. And we want to look at things by age, by geography. And so we shared this information with the whole group so that they would know that it's important to collect these identifiers, and that they need to be collected correctly and consistently, and that those two things are so important in this work. There's a statistic here that as few as 14% of healthcare organizations are using patient data to assess variation in care outcomes. So that was really important for people, I think, to understand, especially our healthcare partners that were attending. So in the Stratford County Public Health Network, again, one of those public health networks that we've been working with, they are collecting survey and focus group data with Gather and other partners. So again, lots of partners, and they used a racial equity lens to identify barriers that residents of New Hampshire face, potentially related to structural racism, while assessing food resources. So they plan to use the information that they've collected to inform their work. In Farm to School, they plan to incorporate questions in their annual food director survey to further their knowledge of food service directors and equity activities that are already happening in schools and food service programs. And I think it's important to acknowledge what people are doing, but also how they can advance it. So we don't know how we can advance the work that they're doing unless we understand the work that they're doing first. So I think that was important for this one as far as data collection. And the Nashua Department of Public Health and Community Services is working to conduct listening sessions and surveys with the Nashua Soup Kitchen to understand the barriers and facilitators to food and nutrition access in Nashua. So looking at their community as a whole and integrating this into their work. We don't have this slide on here, but I just wanted to add that the City of Manchester received ARPA funding to conduct a healthy food access analysis in their community. They did, I think it was 13 focus groups, and they conducted almost 400 surveys and that had evidence-based questions on there about food access, but they also asked a lot of demographic questions, and now they're able to disaggregate their surveys using that data. So I want to say that that was something that was really important that came out of this work as well. And policies and procedures, going back to the spectrum of prevention, we know that when we implement policies and procedures, we'll have the most impact, and that is also why it's part of the culturally effective orgs framework, that we know that when we implement these policies and procedures, they stick. And so making sure that we talked about this with everybody to really understand the importance of organizational policies and procedures, not just big P at the state or federal level, but what each organization could do to implement those things. So again, how do individual organizations play a role in assuring the larger system does this effectively, right? How are the organizations helping to plug people into the power grid? So policies and procedures within organizations, how do we institutionalize practice so it's sustained and not dependent on one person? I know that some of us have experienced that. We have one person who's the champion and that person leaves, and then sometimes the work falls apart or has to get picked up again, and sometimes you feel a little bit like you're starting over. So talking about leadership, do senior leaders monitor equity indicators and metrics? Do they produce a dashboard? Does this budget have a line item? Like, these are things that we went over with our group, was to make sure that we were talking to leadership. We were making sure that we were talking to them about workforce diversity and inclusion. Like, do you screen all your staff for food insecurity? That was a question that came up, and we had a lot of responsiveness to that. There were a few organizations that came up to me afterwards and thought, wow, especially healthcare organizations, thinking maybe we don't pay our employees enough. And if we're not paying our employees enough and we're not screening for food insecurity, are we really recognizing what's happening within our own workforce? And through some of this, some of the healthcare organizations have raised their minimum wage. Staff cultural competence. Is staff training done with all new hires as a part of the standard orientation? So this becomes a policy or a procedure within the organization. So really covering this with all of the organizations that were participating. And on average, I think we had about 50 to 60 organizations around our state participating in each one of these training opportunities. Language and communication access. Are we making sure that we are required to only use qualified interpreters and translators and that meet the quality standards? Do all of your bilingual staff have their fluency verified? Are staff trained to identify, document, and provide communication access accommodations for everyone? So are you making this a policy so that it always happens in your organization? And community engagement. Is it required? Are there resources that are dedicated to it when you're putting your budget together? Are you making sure that you have funds to pay community consultants? Are you making sure you have funds that if you're having a focus group that you're paying the community members for the time that they're participating? Is this a part of the standard operating procedure that you do every time you do one of these community engagement activities, that you're making sure that all of the resources are available? in data collection and analysis. What are your intake forms and what are your procedures? Are they overly complicated? Can they be simplified? Can you add a box? I think, well, we're going to get into the activities, but I'm not sure this one is on here, but one of them that came up was that Meals on Wheels simplified their application process, and they added a box for cultural food preferences or ethnic food preferences. So now anybody who fills out the intake form can pick all of the different types of food that they prefer. And I know that Meals on Wheels does a really great job connecting with restaurants in the communities to hire those restaurants to cater meals for culturally preferred meals.
Jessica, can I add on?
Yeah, absolutely.
So one of the points of this activity where I think we had people help, develop the bullets for what are examples of policies and procedures in each of the other elements. One point is just policies and procedures is one of the 7 elements of the framework, but this really demonstrates how it's integral and very interwoven and interconnected with the other elements, right? So the elements overlap a lot often. But especially with policies and procedures, because the point of organization change and operationalizing these elements is that you are creating policies and sustainable changes that live beyond champions, right? That are institutionalized in the working and official policies and processes of the organization.
Absolutely. Thanks, Trini. So activities that came out of this one, Gather is a large food distribution and pantry service on the Seacoast. They're one of the leaders in that area in food and nutrition access. And one of their board members was participating in this process. And they said from the frame of Gather board to establish diversity, equity, inclusion, and justice committee or other entity that is charged with an authentic commitment to advancing DEIJ work in their policy and practice by December. And their outcomes were to have a standing committee focused on diversity, equity, inclusion, and justice, and that they secure a second board position for a current or former client. So making sure that someone with lived expertise is participating on their board. I'm sorry, I want to go back really quick and just highlight in the partners that they didn't plan on just doing this alone, that they were going to work with other racial equity groups to help define those trainings and what their work would be focused on. Alice Peck Day Memorial Hospital will develop trainings for staff who give out social determinants of health screening. They will also be identifying ways in which they can improve screening for families and children as they mostly screen older adults. So expanding who they are screening and engaging and who they're collecting data about. So we are going to open this up for questions now. If anybody, we have about 11 minutes left. If anybody has any questions, our contact information is here on this slide. If anybody would like to connect with us, feel free to email us. You can also join our mailing list using that tiny URL link. And I see Nader has a question. Go ahead, Nader.
Thank you. Can you hear me?
We can.
Great. Thanks. My question is about the data collection that you presented. And my question more specifically, we in our organization, we had some experience with some group of newcomers that even though they were in need of food, they wouldn't give some information that we were collecting. And how did you, my question, did you have the same experience in some of the groups that you serve? And what was how did you serve that?
I think that some of the organizations that we work with do experience that. And so while we're not a direct service organization and always collecting data ourselves directly from individuals, what we have done is provide a resource of like connecting people to Dr. Tejas to help them work through that if that came up as a need. So what's been nice about the Spine project is that we've been able to hire her as a consultant in order to be able to help any of our our partners and community partners that are having issues with collecting sensitive data. Trini, I see you ready to chime in. So,
yeah, I would just say that in all organizations, healthcare and otherwise, just recognizing the complexities of trying to do data, build capacity within the organization for equity is really challenging. And in fact, separate from the teaching that we did, sort of high level, introducing the concepts and helping people understand the importance of collecting demographic identifiers, because that's how we then disaggregate our data and uncover variation and see disparities between groups, no matter how you slice and dice your groups. Actually, then I went and did a 3-part webinar series, right, on how do we do data for equity, right? Because the doing it, and it's like the question that you raised, right? Like that there's intricacies and nuance and a fair amount of capacity building in staff to be able to handle challenging situations that may arise when they're trying to collect demographic identifiers, right? Some people are uncomfortable asking questions, such as about race and ethnicity. Some people, their own discomfort is what makes patients uncomfortable. Some patients have very good reasons for why they don't want to disclose. Some patients don't see themselves reflected in the current categories that are used in the United States at this point in time, while at the same time there are efforts being made at the federal level to improve the standards. So some states have other ways that maybe in addition to the race categories, they collect granular ethnicity, right? So each organization is a little unique in how it might then choose to address any given situation. So if you had a large population of a certain cultural or ethnic group, you might then have a sort of tailored response to how you handle your data because you want to be respectful and inclusive. And it could be any kind of group, right? It could be an LGBTQ group. It could be people with disabilities. And so the short answer is, in this training, we didn't address it. What we did was opened people's awareness to the need for attentiveness to data and building that capacity within their organizations. And then I think the question you raised is just a good example of the kinds of things that arise as you start to try to do this work.
Thank you.
are there any other questions, comments?
If there aren't questions, I'd posit a question to the audience and find out if anybody has endeavored to do a project like this, or has this inspired as maybe a smaller scale. What does your organization look like? Would you be a partner in this, or would you be an organization that would be a driver of this kind of work? And so I'd love to hear. We're a smaller group, so I'd love to hear some people come off mute and tell us about your states or your region, your city even.
Well, feel free to jump in at any time if somebody has something that they want to add. I would like to say that I think what's been amazing about this process is the ability to continue it on. The National Association for Chronic Disease Directors really saw a benefit in this work and has funded us for a second year. And we were also, because we started this work, able to receive a CDC grant to create a social determinants of health accelerator plan. And so we're integrating the two next year and, looking at the intersectionality between social determinants of health and the culturally effective orgs framework. And I see something from Alyssa in the chat, Tiffany.
Yeah, I was going to go ahead and invite Alyssa off mute if you'd like, and tell us about, it sounds like you have a sort of similar organization to New Hampshire Hunger Solutions, kind of that advocacy policy and hunger umbrella. And if you've endeavored to do anything like this for your state. I see you came off mute, but I don't think we can hear you. I can't hear you, but. Might be a technical issue. Yeah, might be a technical issue. Well, feel free to put any response in the chat.
I don't see a chat. Is there a chat here?
Yeah, there's a chat to the right, Trini.
Oh, I see. It is here for this justice group. Okay, thank you.
Well, it's unfortunate that we can't hear from you, so sorry about that. But I know a little background, I did my master's degree in Oklahoma, and I know that Oklahoma is a very active hunger community or anti-hunger community, should I say. I am a registered dietitian as well. So I did my master's in nutrition at Oklahoma State University. So I've been excited to see Oklahoma engaged in work like this. And I want to say that I saw you, Oklahoma, in another meeting that I was in recently as well. So we get to see you at different national events as well. So new to the organization, Emma and I both work for Hunger Free Oklahoma. We do advocacy and are working on building a hunger-free community in our region. Amazing. That's great. Thanks for sharing, Alyssa.
Well, if you're looking to do more work, I'm not sure if there will be an RFP that comes out again from the National Association of Chronic Disease Directors, but they do have like really great grant opportunities often around nutrition access. So I would definitely keep my eye out on there and get their newsletter, because they're a great organization to work with.
Great. And if you're interested in if anybody in the audience is interested in connecting more and asking more questions and kind of diving into the nitty gritty about what this looked like, and we also have all of our training material and whatnot. So feel free to connect with us directly, and we'd be happy to share our knowledge and resources and training with you, Dr. Tejas, as well. So.
Yeah,
well, thank you.
I'll put the link to the culturally effective organizations information in the chat. I hadn't seen that there.
All right.
Thanks.
And so
Thank you so much for the session. Sorry, Jessica, I didn't mean to cut you off. Go ahead.
Oh, I was just going to turn it over to you, Jenna, so you're good.
Okay, great. Well, I just wanted to thank our speakers, Tiffany, Jessica, and our guest appearance, special guest appearance from Dr. Tejas. Thank you so much for coming. For everyone else, up next is a 30-minute break and an opportunity to check out the on-demand content that we have in the lobby. So we'll begin the next set of the 4 workshop sessions that will address establishing healthy connections in child and retailer food health. To join one of those 4 sessions, all you have to do is click workshops in your navigation bar to the left of your screen. And then you can view all 4 workshops being offered by clicking the blue arrow to the right, then click enter the session. And just a reminder, one of the upcoming workshops called Expanding Healthy Food Options at Retailers will be presented in Spanish. English interpretation is available. And that concludes our workshop. So to exit the session, please go ahead and click the red phone icon on the bottom of your screen now, and then go ahead and click leave. Thanks so much. Have a great rest of your day.